My name is Paul Welaga from Navrongo Health Research Centre. I'm a PhD student working on looking at the effects and non-specific effects of vaccines on child health. What immediately comes to my mind is the health of the populations globally. Health that transcends or goes beyond individual countries, regions, but health issues that affects the global world, everyone, either directly or indirectly. This is all about how to improve health for all. From conception to delivery, we make sure that the mother survives the period and the child is born alive. And when he's born alive, we should make sure that we are able to monitor this child and provide the necessary conditions for the child to live, especially during the first 5 years of life. And for malaria, it is still a major issue, even though a lot of interventions have been put in place to reduce malaria and HIV. The levels are still high, and we need to make sure that we put in interventions to reduce malaria and HIV. And for the communicable diseases, a lot of people are now dying prematurely, particularly from cardiovascular diseases. And it is important to pay attention. And it is rising globally because of life changes. Across the world. Even less in the developing countries, more and more people are changing their lifestyles and then are becoming more stagnant instead of exercising. So more and more cases of cardiovascular diseases are being recorded. First of all, I'll prioritize it based on what I consider to be the 3 important issues. How do we make sure that children survive? This requires that we make sure we improve the health systems, particularly for the less developed countries, making sure that deprived areas at least have improved health systems to be able to take care of mothers and children, to make sure that when a mother gets pregnant, a woman gets pregnant, she's able to go through the delivery process and deliver safely. And make sure that when the child is born, the child also gets all the safety nets to be able to survive within the neonatal period. So this is a challenge, and it requires more investment into it. It's also important to pay attention to the existing interventions that are being put in place to improve child survival, including the introduction of vaccines, and to monitor these vaccines to make sure that they are safe for the children to be able to live longer. I'll put child survival or child health in general, and we can't talk about child health without maternal health. So maternal and child health usually go together. From infancy, from the neonatal period, that's the first 28 days, up to 5 years. That's where we record so many deaths. And maternal deaths too is also becoming an issue. Even though in the developed communities, they have been able to reduce it drastically, it is still a major challenge, particularly for the less developed countries. As we advance, more and more new challenges or health issues will come, which will require global solutions and global perspectives. There will be more new emerging diseases and threats. Once there are human beings, there will be threats to their health. So global health will continue to exist, and it will only go away if the last person dies. So global health will continue to exist in the next 10 years and beyond. That's my view.